Vitamin K is a fat-soluble vitamin that plays a critical role in blood clotting, bone health, cardiovascular function, and various metabolic pathways. Despite its importance, it is often overlooked in dietary considerations compared to other vitamins like C, D, or B complex. Scientific studies have increasingly highlighted the multifaceted roles of vitamin K in human health, making it a subject of considerable research. Vitamin K exists in two primary forms: K1, phylloquinone, and K2, menaquinones. While K1 is primarily found in leafy greens and supports coagulation processes, K2, found in fermented foods and animal products, is involved in calcium metabolism and cardiovascular health. Scientific evidence suggests that vitamin K acts as a cofactor for the synthesis of clotting factors such as 2-prothrombin, 7-X, and X. Deficiencies can lead to prolonged bleeding and, in severe cases, hemorrhagic conditions. Newborns are particularly vulnerable due to their sterile gut, which is why vitamin K injections are routinely administered at birth. Osteocalcin, a protein essential for bone mineralization, requires vitamin K for activation. Studies indicate that individuals with higher vitamin K intake have a lower risk of fractures and osteoporosis. Postmenopausal women and the elderly benefit significantly from vitamin K supplementation in conjunction with calcium and vitamin D. Vitamin K2 has been shown to prevent arterial calcification by activating matrix GLA protein, MGP, which inhibits calcium deposits in blood vessels. Longitudinal studies demonstrate a correlation between higher K2 intake and a reduced risk of coronary artery disease and atherosclerosis. 5. Vitamin K and aging. Effects across different age groups. 1. Neonates and infants. Vitamin K is crucial for preventing vitamin K deficiency bleeding, VKDB, a potentially fatal condition. 1. Due to low placental transfer and an immature gut microbiome, infants require exogenous vitamin K. 2. Children and adolescents. Essential for bone development, vitamin K aids in peak bone mass attainment. 2. Studies show that deficiencies in childhood can predispose individuals to osteoporosis later in life. 3. Adults. In this age group, vitamin K supports normal blood coagulation and prevents early vascular calcification. 3. Sedentary lifestyles and poor dietary habits can contribute to subclinical deficiencies. 4. Elderly. Age-related decline in bone density and cardiovascular health can be mitigated with adequate vitamin K intake. 4. Research indicates that higher dietary vitamin K levels can reduce fracture risk and improve arterial flexibility. 1. Vitamin K in disease prevention and management. 1. Osteoporosis. Clinical trials revealed that supplementation with K2 can reduce bone loss and improve bone strength in osteoporotic patients. 2. Cardiovascular disease. Longitudinal studies suggest that K2 reduces arterial stiffness and lowers cardiovascular mortality rates. 3. Cognitive function. Preliminary research indicates that vitamin K may have neuroprotective properties, with higher intake linked to better cognitive performance in older adults. 4. Diabetes and metabolic syndrome. Some studies propose that vitamin K improves insulin sensitivity and may lower diabetes risk, although further research is required. Dietary sources include green leafy vegetables, spinach, kale, fermented foods, natto, cheese, and animal liver. The recommended daily intake varies by age and gender. 1. Infants, 0–6 months. 2.0 mcg per day. 2. Children, 1–3 years, 30 mcg per day. 3. Adults, 19+ years, 90,120 mcg per day. 4. Pregnant and lactating women, 90 mcg per day. Vitamin K deficiency can arise from poor diet, malabsorption disorders, e.g., Crohn's disease, celiac disease, or prolonged antibiotic use. Symptoms include easy bruising, prolonged bleeding, and in severe cases, hemorrhagic disorders. Recent studies highlight that supplementation can be particularly beneficial for individuals at risk of osteoporosis, cardiovascular disease, and those on anticoagulant therapy. However, excessive supplementation should be approached cautiously, particularly for individuals on blood-thinning medications like warfarin. Conclusion: vitamin K is an essential nutrient with profound effects on human health across all age groups. From supporting neonatal clotting mechanisms to preventing age-related osteoporosis and cardiovascular diseases, its role is indispensable. Scientific evidence strongly supports adequate dietary intake and, where necessary, supplementation to mitigate health risks. Future research will likely uncover additional benefits, further cementing vitamin K's significance in nutrition and medicine.